Thank you, Chairman. And again, thank you to the witnesses for being here today. Last October, the GAO said the ASPR, the Assistant Secretary for Preparedness and Response, needs to develop a clear approach for buying medical countermeasures for the national stockpile, regardless of whether they received development funding from BARDA, or Biomedical Advanced Research Development Authority. So Assistant Secretary O'Connell, without a clear process in place for the stockpile to buy countermeasures, will you commit to implementing GAO's recommendation to document an approach to make sure there is equal consideration of medical countermeasures?
Senator, thank you so much for that question. Absolutely. We're working closely with GAO to make sure that, that we can take into account the recommendations they make and implement them. Of course, making sure the stockpile has what it needs is a focus of mine. And we have the FEMC, which is an interagency group of experts that come together to give advice to myself and the Secretary on what should go in there across all of the various material threats that DHS has issued.
Thank you for that. Congress created ARPA-H, or Advanced Research Projects Agency for Health. As it is currently outlined, many of its authorities overlap with efforts undertaken by the Assistant Secretary for Preparedness and Response, or ASPR, you. So what steps can Congress take to increase interagency coordination and remove some of the duplicative efforts between ARPA-H and your agency?
Senator, thanks again for that question. So we are really proud of the work that BARDA does, and BARDA's work is limited to developing countermeasures to make us more prepared against the threats that we see coming. ARPA-H has, as I understand it, a wider remit to develop innovative products against any disease or threat, not necessarily the national security threats that we're responding to. But it is important that we have good collaboration between our fellow agency, and we work very closely together and continue to stay in touch. But I see a very clear lane for BARDA, and it's important that BARDA stay in that lane in order to keep this country more prepared and ready to respond moving forward.
Thank you. Decentralized clinical trials, where trials take place at locations other than at a research center, like a patient's home, can make groundbreaking cures more accessible to patients who otherwise wouldn't be able to participate simply because of where they live. And we saw how important these flexibilities were during the pandemic. So, Commissioner, what steps can Congress take to reduce the barriers for patients to participate in these trials to improve accessibility for those with rare diseases, maybe they're elderly, or they have mobility issues?
Thanks, Senator. Being a fellow North Carolinian, which has got some cities, but it's also a very rural state.
I didn't have your bio in front of me, but I appreciate the accent. I was wondering if we lived nearby.
The big city of Durham is where I've lived most of my life. And this is really important. We just put out a guidance on this. Decentralized trials are on the way. It's dependent on digital technology. So if you ask me, the most important thing you can do is to make sure the funding for internet expansion to all the rural areas. I know the bill is passed, the funding's allocated. We've got to make sure that those digital tech pipes are deployed out there. I think the methods are coming along great. I spent time at Alphabet. There's no question that we have technology that everyone in this country can use. Almost everyone has a cell phone. So the methods of doing this are not requiring the big research center, unless it's a specialized area that you need special medical exams. That's the way to go.
Very good. Thank you all again. Chair, I yield back.
We owe you a minute. Next.